would say it was difficult for me because I didn't necessarily have the self-confidence, being so brand new and not really knowing if I knew the right information to be bringing to people. So I actually did a lot of homework just so that I could feel confident um, going into certain situations or meetings. But what was difficult was if you had to interact with, like, say, a nursing leader, a nurse manager on a unit, and you were trying to get your point across about like some aseptic technique or issues around, that something might have come up around infection control. And you were like, say, trying to share the infection prevention specific information without necessarily feeling like I could speak her language as far as the clinical side. And so it was a little bit intimidating, you go in and say, I think I think we might have an issue we need to talk about. I noticed, something going on in the unit. And then like, how do I approach that? So that was a difficulty for me. Again, just not being sure. And so, what I learned to do to start gaining that confidence and then maybe the trust in the clinical teams was when I was unsure, instead of pretending or going back and doing the homework on my own and really still not sure if I understood, I just started to ask people to show me. And so if it was something around aseptic task with a line or an IV, and I had never done that task. And so I just said, can you show me? If you show me the clinical side, I can probably interpret, what's clean or aseptic about this, or what we might have a concern about. And so I learned to like just partner and acknowledge that I didn't know it all. I don't know it all, but I know you have this part of the information. And so I think that really was a turning point for me when I started to say, can you show me? Because I'm not a nurse, and people started to be like, oh, okay. Yeah.